What is factitious disorder? This is a question I am asked almost daily, because we all want to know what factitious disorder is. Factitious disorders are conditions in which a person acts as if he or she has an illness by deliberately producing, feigning, or exaggerating symptoms. The motives of the patient can vary. For a patient with factitious disorder, the primary aim is to obtain sympathy, nurturance, and attention accompanying the sick role. There are many possible causes for FD. One such possibility is an underlying personality disorder. Individuals with FD may be trying to repeat a satisfying childhood relationship with a doctor. Perhaps also an individual has a desire to deceive or test authority figures. The underlying desire to resume the role of a patient and to be cared for can also be considered an underlying personality disorder. Abuse, neglect and/or abandonment suffered during childhood are also probable causes for the disorder. There are no psychiatric medications to prescribe to FD patients, but selective serotonin reuptake inhibitors can help. This is because such medicines treat mood disorders, and mood disorders may be an underlying cause of FD. In order to diagnose a patient with FD, they mustn't be diagnosed with any other mental disorder. They must also be playing the sick role and do not act sick for personal gain. Cases of factitious disorder appear in the medical literature as early as Galen, a famous Roman physician of the 2nd century AD. The term factitious is derived from a book by an English physician named Gavin, published in 1843, entitled On Feigned and Factitious Diseases. The modern study of factitious disorder, however, began with a 1951 article in Lancet by a British psychiatrist, Richard Asher, who also coined the term Munchausen syndrome to describe a chronic subtype of FD. In 1977, it was Yellinger who first reported a case of FD with primarily psychological symptoms. Factitious disorder was recognized as a formal diagnostic category by DSM-3 in 1980. FD is a disorder between hysteria and malingering. In the 20th century, patients felt hysteria and malingering were too distant. This may have led to the development of a middle ground, factitious disorder. Pediatric nurse Beverly Allett, who was thought to have suffered from both Munchausen syndrome and Munchausen syndrome by proxy, killed 4 children and injured 9 others between 1991 and 1993. Over a 58-day period in 1991, a series of mysterious deaths, illnesses and injuries struck at the Grantham and Kesteven Hospital in Great Britain. In 1993, Allett was convicted on 13 charges of murder and causing grievous bodily harm. She is serving 13 life sentences and is being held at a top-security prison hospital in Nottinghamshire. Well, that's the overview of factitious disorder, or Munchausen syndrome. If you have any further questions, please just ask Robert here.